There are times during a fire service interview that a panel might phrase a question in such a manner that it sort of gives you permission to do something that your gut feeling tells you you probably shouldn't do. Keep on guard for this type of question, and remember, following protocol, training, and supervisory direction is always the goal in your answer. This question is worded in a manner that implies the supervisor may not be making a perfect decision, and maybe, just maybe, you should persuade the supervisor to change his or her mind. My associate behind the camera will ask the question, and I'll answer in the proper manner. Here we go.
You're on scene at a fire and EMS call. You're serving in the capacity of a paramedic and treating a patient by holding C-spine traction. Suddenly, without notice, a newer lieutenant runs up to you and tells you that you're needed at the ladder truck immediately. Now, you've heard this lieutenant has a tendency to overreact at times, and you're not quite sure why he's sending you to the ladder truck. He informs you that he'll take over C-spine. You have reason to suspect that your patient has a spinal cord injury. Now, are you going to respond to this unusual order, or would you inform the lieutenant that you're unable to respond to the fire scene due to your need to continue C-spine?
I recognize this is an unusual directive, but regardless of what I've heard about a particular supervisor, I wouldn't begin debating his or her order to take on a different task. I trust that a supervisor knows what must be done at any given scene, and this is certainly not the time for debate. I'd be sure to express my concerns about the patient's condition and the reason that I suspect spinal cord injury. Once I did that, I would transfer my duties from the patient using proper protocol and immediately direct my attention to the ladder truck as the supervisor directed me.
What if the patient began protesting and said that he wanted you to stay with them? Would your approach be different?
Assuming that my lieutenant heard the statements made by the patient, I do one of two things. If my supervisor began speaking, I defer to his or her authority and allow them to manage the patient's concern. If, on the other hand, my supervisor didn't begin speaking, I'd assure the patient in a calming manner that they were in very capable hands with my lieutenant and that I was urgently needed elsewhere and begin to transfer my traction to my lieutenant. Again, I understand the dynamics of this type of work and how scenes can change from moment to moment. If a supervisor orders me to begin doing something, I must do so without debate. So the oral panel will sometimes give you situations that are worded in a manner that causes you to think they're looking for an answer different than what you might feel is the correct response. In this question, the panel attempted to cause you to believe that turning your patient over to your lieutenant might not be the best approach, when in fact, it's the only correct answer. They even went so far as to say that you've heard the lieutenant sometimes overreacts. It's as though they're giving you permission to challenge your supervisor. Now, don't ever bite on this type of tactic. If you're directed by a supervisor to perform a function that you don't agree with, too bad. You must abide by that order. The exception, of course, is if the order or directive was not safe for you or the patient. Now, you enhanced your answer by stating that you'd be sure to express your suspicion that this patient had a spinal injury, and you heard me say I'd follow proper protocol for transferring patient care. You not only hit the nail on the head with this answer, you've given a bit of outstanding extra credit. There are a number of questions that any given panel can or might ask you regarding directives given to you by a supervisor. Regardless of the introduction given by the panel, and by introduction I mean, suppose they tell you you're dealing with a supervisor that you feel isn't very intelligent, or a supervisor that you've never gotten along with, or any other number of introductions that gives you the idea that the panel wants you to rather dislike the supervisor. always do what the supervisor tells you to do, and you'll be on solid ground.